Thank, thank you, Coy. I would like to welcome everyone to this month's We Care Committee call. I'm very pleased to kick off another WCC. For newcomers here, my name is Amy Runkle. About a 39-year-old CNA, 39 working years CNA. I'm also a delegate in my shop. I'm a proud member organizer for 1199 SCIU, and my commitment is to improve care conditions in nursing homes, hospitals for our patients and our staff. I'd like to give you a little background real quick on the We Care Committee. Um, so, flip this page. So the We Care Committee is a group of hospital and nursing home workers, elected officials, advocates, and community leaders who share the same goal, and that is to improve the quality of care in our nursing or our healthcare facilities. Um, for that to happen, um, yeah, several critical issues must be addressed, which is unsafe staffing levels, retention, low wages, greater transparency and accountability of facility owners, and respect for all workers. And you know what? We will never stop fighting to make Florida a better place for everybody. So, with that being said, last month, our topic was a very important healthcare ballot and tentative Amendment 4, which protects women's healthcare and reproductive rights. Many of you on the call tonight attended the exciting, very exciting, I was there, rally in Orlando this past weekend to show your support for Yes on 4. I was proud to see and join such a strong turnout of 1199 SCIU family. It was big. For those of you that missed it, I mean, you really missed it. That was so awesome. The people that showed up, the purple that was there was just absolutely unbelievable. I loved it. Let's see. So tonight's main topic will be highlighted the recent layoffs and department closures at North Shore Medical Center in Miami and the impact on patients and caregivers. The hospital is owned by Steward Health Care, which is having problems here and other states. Organizer Mark Criswell will provide an overview, and then he will hear directly, or we will hear directly from members. Liz Gusley something, I'm so sorry, Rizzo, a former employee at North Shore Medical Center, and Wanda Jenkins, a member. So I would like to, at this time, go ahead and invite Mark to go ahead and come off mute and take it over.
Oh. Can you hear me? Can everyone hear me?
We can hear you.
Yes, we can hear you.
Perfect. Trying to get the camera so I can. Okay.
We can see you too.
Okay. Okay, perfect. Really, I want to correct something. I know you mentioned that Steward owned the hospital. Steward doesn't actually own the hospital. It is actually owned by Medical Properties Trust that owns the real estate to the hospital. Somebody's not on mute.
1 second, Mark. 1 second, Mark. I'm trying to find the person who's not on mute.
See, this is what I was talking about with the episode.
Sorry, you guys are not on mute. If you could, thank you. Thanks. It's 108 people, so it's hard to find, but go ahead, Mark.
I understand. No worries. Thanks, Coy. Like I was saying, Steward is not the actual owner of the real estate. It's actually owned by Wall Street, a private equity company known as Medical Properties Trust. And to understand how North Shore Medical Center laid off 152 people and closed mental health services, and also closed all the women's services, you have to understand, we have to give you some background to how Steward got to where they are financially. So like I was saying, Medical Properties Trust is a private equity. It's Wall Street traded. It has investors and shareholders. And at about 15 years ago, they saw an opportunity where they could buy hospitals that systems that were not necessarily failing, but could be improved. And they saw a way to go in, buy the real estate, and lease it to a property management company like Steward Health Care to manage the day-to-day operations and pay Medical Properties Trust rent money. So having said that, profitable healthcare chains don't conduct leasebacks, and they definitely they don't do that. And they for the major reason is because of the rent, because rent will continue to go up under these circumstances. So what's happened with Steward is Medical Properties Trust has leased these hospitals to North Shore to them, and as of December 23rd, they owe over $50 million in past due rent to Medical Properties Trust. It's also important to understand that Steward Health Care is 25% of the equity in Medical Property.
Excuse me, Mark, you're on mute. I'm sorry. Somehow you got muted.
Okay.
There you go.
Okay, that's okay. And so what happened is Medical Properties Trust, because Steward is 25% of their business overall, they created an action plan designed to strengthen Steward's liquidity and restore its balance sheet. MPT gave them a bridge loan, which helped them begin the process of recovering some past due rent from Steward Health Care. In exchange for this bridge loan, Steward had to sell their physician group, and they are trying to re-tenant other hospitals, either sell them outright completely or have other tenants come in and manage the day-to-day operations. The bridge loan that they got from MPT was over $60 million. Okay, and now I want to talk more about Steward. Steward was formed in 2010. System-wide, they have 35 hospitals. I did mention they're 25% of Medical Properties Trust business. Their financial problems started because Medical Properties Trust continues to raise their rent by 5% every year annually, and system-wide, Steward owes over $400 million in rent annually is what they pay, and they're behind. As you can see, there's some on the screen. They had issues in Massachusetts. The state of Massachusetts would like them to leave. They've are trying to sell hospitals and close hospitals, but I think the point I'm trying to make here in all of this is that the government and public officials need to look at private equity in our healthcare system. And currently, private equity, because this is not a novel situation we are in, where these closures are happening and continue. There are other equity firms out there that function similar to Medical Properties Trust. And having said that, Medical Properties Trust these equities they actually make up 30% of our healthcare system currently. Right now, and so this is a big chunk. And what's happening is they're coming in and they're bleeding. They're just taking the money out and they're not reinvesting into these hospitals. And when a company like Steward can no longer afford the rent, you know, we have layoffs because Steward is trying to stay solvent. They're trying to stay solvent, but North Shore, if you guys are not familiar, North Shore serves a community that really needs mental health services, number one, and women's services. You know, Florida already is taking so much away from women, and it's just unfortunate that this is happening in the community. And I think the community awareness about this needs to be, you know, spoken upon. I think I know that we don't want to, politicians don't really want to get involved in private businesses and stuff, but you know, this is more of a community call to action, I guess, if you will. But so where Steward is right now is about 2 days ago, an article came out saying that they may not be solvent by the end of this month, that they may be moving towards filing for Chapter 11 bankruptcy. And unfortunately, all their financial problems have nothing to do with the state of Florida. Their problems started up north with Massachusetts mainly, and other states as well. Texas is another one where they've closed hospitals, shuttered services, things of that nature. And it's just been an open wound in our healthcare system. And the bleeding came down to North Shore Medical Center. And for them to continue to stay solvent, they laid off 152 people and closed all these services. It's on the screen, the neonatal intensive care unit, our labor and delivery, mental health and obstetricians. And it's just a real unfortunate thing that Florida has just been a casualty of all this. Actually, Stewart's financial situation, Florida is actually like their healthiest market. So even though we are feeling all these problems, they did not start here in Florida, and they're bleeding into the state of Florida, and which is ultimately affecting the community. Stewart's unable to pay their vendors. We have a ton of vendor issues, which Wanda will speak upon in a moment. Getting supplies for having surgeries have been a problem. I can give you one example. They needed to do a surgery on a patient and they had to transfer them out because they did not have the anesthesia to do the surgery. Medications, nurses are having in the ER are not able to access their medications, their narcotic medications in the Pyxis, mainly stat medications, because Steward hasn't paid the vendor. So they have an agreement with the vendor that the vendor will release 2 machines in the hospital, but now you have nurses from these departments having to go down to either the pharmacy or to the machine and wait in line to get their patients' medications. And mind you, in healthcare, everything's about time. And so if it takes an hour for a nurse to get a stat medication, that patient could be compromised and you know, potentially die. So, you know, this is causing staffing shortages. And I'm not going to get too much into the issues because I'm going to let Wanda and Liz talk more about that. But I think that it's just important to understand that we need really for the governments, you know, the federal government to, and even the state government to look into private equity, because these things kind of seem like a Ponzi scheme that Wall Street has, you know, done. And quite honestly, the closer you look at this, this is kind of reminds me of the housing bubble that happened in 2009. I feel like healthcare in this country is on the verge of this just popping and imploding on itself. Because we have private equity involved in our healthcare system. And, you know, pharmaceuticals have invaded every aspect. Corporations have invaded so much that we have to really stick together and be the real advocates for workers and for the patients that we service in the community. So having said that, I think I'm ready for Wanda and to speak upon some of the current issues that she's dealing with at North Shore. Wanda, you gotta come off mute.
I see you're off camera, Wanda, but you have to unmute yourself.
Okay, here we go.
There you
I'm
go.
off mute. All right.
Thank you, Wanda.
Hi, thank you. Hi, my name is Wanda Jenkins. I work at North Shore Medical Center in materials management. You can hear me?
Yes.
Okay. The problem that we are having is like getting supplies in there. What my job consists of, I'm a supply chain coordinator. I get supplies for the OR. I have to put in the order, and if we are on credit card with that vendor, what we have to do is put the order in, get a PO, and then we have to get a performer invoice from that company. And then we have to send that up to the CEO to get approval so we can just order that one supply so the case could go on. And I see now some of it is clearing up, but I think we would have more surgery and more everything if we can get more supplies for the doctors to come in. And that's it. Oh, I got off. Cancel. Hello?
We hear you. Thank you, Wanda.
Okay. I need to get off and go on mute. I'm having problems
I
now.
got you. I got you.
Okay.
Back to you, Mark. Or we
Yeah,
want to go to
so
Wanda?
no, that's okay.
Liz.
So, you know, what the other thing I know Wanda wanted to really mention is that the morale at the hospital is really down, and the census keeps going down. It feels like the physicians that have left North Shore have been out in the community telling people not to come to North Shore. And you know, as a result, the census, I mean, at times is like 69 patients in the whole facility. So, you know, Steward may say that the future is looking up financially, but really at this point, I don't really see a way for them to be solvent and continue to provide quality care service, because ever since they came into the picture, the quality care has definitely gone down because of the way they manage, the way they order supplies, the way they owe too many vendors too many money. And currently there's 35 lawsuits in multiple states, and they're all collections related to non-payment to vendors. So, you know, I want to have Liz go ahead and jump on and talk more about her. She was an impacted employee. She's no longer employed at North Shore. She is a former delegate of the union, and you know, she's an advocate for the community. And also in this particular area, I didn't mention, what's really interesting is there's a lot of gentrification happening as well in this area. So I think my concern is for North Shore is that the land value itself, the real estate that MPT owns, is worth more than the actual business of the hospital. And I'm afraid that we're going to go down a path eventually where some developer is going to come in, buy the land from MPT, they'll close the hospital, tear it down, and build a high rise. That's my concern. I lived in Chicago for 10 years. I watched gentrification happen very quickly there during the time that I lived there. But go ahead, Liz. I'm going to stop there and turn it over to you.
Okay, hi folks. My first name is Liz Gasella-Rizzo. Yeah, I know it's kind of complicated, but everyone messes it up. It's really interesting listening to this talk because Mark asked me to prepare 7 minutes of talking. And I'm like, well, I can look up stats on mental health care and this and that. But as the meeting has progressed, four things were popping up. One was, one aspect is the closure of the of these units is approximately maybe 60 to 80 beds. So that would show a big decrease in patients that we have there. That's important. We all know that there's a mental health issue that has been in crisis mode. And for this hospital to lose a 40-bed unit, it was started in 1985. So it just missed a full 39 years, along with Palmetto closing their facilities for psych, along with the UM closing their hospitals in around 2014 or their psych beds, along with Hialeah closing their psych beds, that we seem to be getting into a bigger crisis. So we realize that. Then we also have to look at the community, because it's a neighborhood. We could look out the windows and see the houses. People in the neighborhood would come and walk the campus because it's enclosed and they feel safer. So we would see people walking with their walking sticks and this and that. So we're part of the community that can no longer take care of the pregnant women and the patient and people who have psych issues. The third thing is we're of course impacting staff. I mean, thank God we're a union hospital because at least I'm getting severance pay. But the issue is I'm still looking for a job. So I and a lot of other people, we're no longer in the community going to McDonald's, going to get Popeye's chicken. We've pulled out supporting businesses. We don't go and get the crab cakes and everything. So we're affecting it, along with we're affecting the union membership. We had a lot of people. On my psych unit, there was about 65 to 70 full per diem part-time, and 70% were union members, either signed up at orientation by Wanda or by me through the years. And I've been a delegate for was for about 7-8 years. We've lost our power in that facility to negotiate. And we're supposed to go into contract negotiations in 2025, if we're even there. So the impact this is happening is on 4 aspects: the community's mental and women's health, the local economy, the staff's economy there and in our home areas, and also the union economy. That's a lot of dues being lost and a lot of delegates that left. I'm not there anymore. Some other people have just moved on that were new delegates. So this is a big issue. I don't know if you have anything else you want me to add, but Steward is terribly mismanaged. I'm paying for my medical and dental, and they shut me off as of March 1st, and it took me 2 weeks to get things reinstated so I can go and get my eyes and my dental appointment. It took 2 weeks, but I got it done with a lot of emails to HR and to the Texas main office. So there we go.
Thank you, Liz. Are there any questions that anyone has?
Yes, Mark. My name is Amy, and well, let me come off camera here. There we go. Gosh, I appreciate. Can we mute people, please?
I'm trying to, 1 second.
Hi, Sandra Reed, if you can.
Not allowing me to mute anybody. Hold on one second, y'all. Sorry. I have to remove her. I'm sorry. Okay, I think you should be good to go. Mark, you should be good to go. If you can come off mute, let me know. Hold on, Mark. Technology. God, I love it.
Okay, I'm off mute, Coy.
Thank you. I don't know what happened with Mark, but back to you.
It
Amy.
might be he can't come off because I was having trouble coming off. It said you muted everybody and we couldn't come off mute. So you might have to let him come back off. But
Got it. I think
anyway,
we're good
Mark,
now.
No, I'm okay now. It just
there
was
you
saying the
go.
host wouldn't let me come off mute for a second.
Right, that's what it was. Okay, Mark, you and Liz and Wanda, that was tremendous information and some great stories. I do have a couple of questions, and we're gonna do some question and answers. And if anybody else has any questions, anybody else has any questions, please raise your hand.
How do we raise our hands? Because I have a question to ask.
Floor is yours, Jackie.
Um,
Oh, she went on mute. You went back on mute, Jackie.
can you hear me now?
Yeah,
Yes.
good.
I don't know if it was Mark or the one of the young ladies had mentioned that, I think it was Mark, where it was only 69 patients that they would, get. I wanted to know how many beds that the hospital would actually hold. How many beds there, patients' beds?
It's over a 300 bed facility.
This is DeQuasia, Jackie. It was a 310 bed facility.
Wow.
And Mark talked about, I think before, like the census has not fluctuated above 100. It was 89. It was 49. It's been
Wow.
69. If you take out, Liz, in your department, the psych beds from 310, and you take out women's services, which was labor, delivery, mother, baby, etc.,
Wow.
those units closed, that still leaves the hospital at about 200 or 250 beds. So even having 69 in the place that can still have over 200 beds means that the census is really, really low.
Very, very low. And the reason why I was asking, it concerns me because I did deliver my first child at North Shore Hospital. Yeah, I did. And that's why I'm like, wow. And there was another question I had about, I think Mark said something about gentrification in that neighborhood, because I know it's predominantly Black neighborhood there.
Yes. So in around like the area of 79th to 95th in that corridor, there's a lot of real estate that has been sold and they've torn it down.
Okay.
They're building like nicer
Yes,
homes.
and again, my condolences.
Oh my God.
I'm so heartbroken
And they built the Jewish community has also built a massive school across the street from North Shore, and they are buying up houses in and around that school, and they're gutting them, in some cases tearing them down completely and rebuilding them. And what ends up happening is when you put something brand new that's bigger in this type of area, the other houses' property taxes go up because the
Right.
value is around them. And
It goes
what we're
up.
going to see happening, I mean, it's already unaffordable to live in Miami
Yep.
for most people. So these are generational families that have been in this
Yes.
neighborhood that are going to
Yes.
be forced out because they're not going to be able to pay the property
Afford the
taxes
property tax,
anymore.
exactly.
Yeah. And then that's my fear with North Shore. It was built in 1951. So we're looking at a 70-year-old building.
Mhm.
And if you just own like I said, the real estate value is probably worth more than the business itself at this point.
Mhm.
So, for me, I'm just making that prediction. It's not something that is like, you know,
So with the census
but
being that low, I'm sorry, I didn't mean to cut you off.
no, go ahead.
So with the census being that low, that means, and you said it was like a big layoff? Because I mean, if you
Yes.
don't have those departments like women's services and the psych department, so that's a lot of people that don't have jobs. And then with the census being as low as you stated they are, for what would be a 210
You said something?
beds,
Yeah.
that's a big drop. So that means that people are being canceled, workers are being
Yes.
canceled at a high, oh, okay.
Yeah, and the problem and I'm glad you brought that up because that is becoming a problem now because people are being forced to use their PTO to cover those days lost.
Right,
And
right.
and the reality is PTO is not pay yourself because you don't have work today. That's not the intention of that.
It's
And
personal.
so and people have really exhausted their PTO bank. So now some people are getting canceled and they aren't able to have a PTO to replace that lost day.
Right. Wow.
So it is starting to become a problem. Absolutely.
That's a huge problem, a huge problem.
And also with the low census, the other contractors that are in the building, like the food service, specifically have also laid off a couple of people and they have also reduced some full-time employees to 21 hours and they lose their benefits as a result
Right,
as well.
exactly. That's
So,
awful.
yeah.
Can I add something to what the question you were
Yeah.
asking? Okay, so this is Liz again. I've been there since 1988. We had Vetus unit. It was the original Vetus unit for, they were a contractor there. And that was the very first unit they ever opened. And they pulled out of their 20 beds, probably near the middle of the pandemic. We also gave a whole unit to the Justice Department where they bring people that need medical care and they're escorted and they're actually in shackles, and the corrections work there with our nurses and our techs. So we were already dropping numbers going in. Pandemic years, we were really busy. We were, there's probably was about 245 active beds. So now the numbers are dropping, obviously, from the 80 beds we lost out of OB, women, and psychiatry. The second thing I wanted to say is we were very active in trying to be vocal in the community. I personally contacted Miami Times because when Steward first came in 21, they started closing the psych unit at Florida Medical Center, and then they closed Palmetto's psych unit. So we fought really hard. So we had the contacts, and if anyone was in the area, there was a wonderful article published in the Miami Times and the Biscayne Times for the month of March. And that they interviewed a lot of us who I, for one, did not give my name, so I would not have a problem with my severance package. But we had a couple people who weren't in the union or they were willing to utilize their names and pictures. It was an excellent, excellent article. But we're still gone. So we didn't take it sitting down. We really tried to make it known. We were on channel 7, we were on channel 10, and we just missed channel 4. So we were proactive on the psych unit and OB.
Mark, you had two hands, Sajan and Carrion and Roxy Nelson.
Okay. Sajan?
I'm still here.
Go ahead.
Hey, Mark. Hi,
Hey.
everyone. I'm Sejan Kurian, working at Florida Medical Center. I'm a delegate and a part of the, our 1199 SEIU. Liz, sorry about your story. I feel you. We miss you. The same thing goes on with Florida Medical Center in Oakland Park. So, and it's getting worse. Mark and we're all fighting for it. We do have an issue with patient safety and workers' safety issues because of vendors not supplying their because of their payment, they didn't get paid. So it is the next to go would be Florida Medical Center, and that's going to be a huge setback for the local communities because they rely on care through the medical facility that we have.
And also, they closed behavioral health there a couple of years back. Yes.
BHU unit was closed last year. Yes.
Yes. I can't see any hands. You said Roxy?
I think Roxy lowered her hand unless she has something to say, but I see Blanche Norwood's hands up now.
Hi, Blanche.
I didn't lower my hand.
I didn't. I don't.
But Blanche can go first, and then I'll ask after Blanche. Go ahead, Blanche.
I clicked the button twice to ask Blanche to unmute. Can one of the other co-hosts, Aaron or Coy, try to get Blanche to unmute? I just requested to unmute, but it doesn't look like Blanche can come off of mute.
Same. We can only request that they come off mute. We can't unmute them.
Am I off mute now?
Yes.
Yep. Okay, I'm saying how if you're getting new residents inside of the hospital, how are you going to manage the care if we don't have people to work?
That's a great question.
Because it's like I was thinking about coming there one day. My sister told me, she said, "Oh no, don't go there because people are checking in, they're not checking out."
Yeah.
So what is the process that we're going through now?
Well, I mean, the facility is staffed. I mean, they have to maintain a certain level. So if it's not our staff, they've outsourced in the past, you know, medical staff, but they've really tried to cut back on doing that. Right now, it's just a revolving door. I mean, we do orientations constantly, and we see people come and they get a little experience and then they go elsewhere for opportunity because, you know, people really do feel unstable working for Steward. We don't know if they're going to be here tomorrow or the week after, etc. So people are applying. We're not short on getting people in orientation, but when they actually get in the building and really see things for what they are, they're getting out as quick as possible because it's a very scary place. And not to mention, it also puts staff licenses at risk as well because of their poor management with everything. So
thank you, Roxy.
Hi, good evening, everybody. I hopped on the call, just landed from Chicago, but I wanted to sort of hear the delegates and the workers from North Shore share about what they've been going through and leading through, and really appreciate hearing from Wanda and Liz, especially about their experience. What I want to thank the organizing team and the delegates for shining a light on this really critical issue that's happening in North Miami about care, right, and our community, and really clarifying what's at stake both for the residents of North Miami, but then also folks who work there and what the loss of those jobs means to that community. Liz, that was really brilliantly said. I think one of the things, besides just awareness, I'm curious from the team, what are we going to do about it? because we have, when I first got on, there was like 128 people on this call. That's a lot of power. And I think at this point, you know, the issues that was raised by Liz of like, where are people gonna, Jackie said she had her first child at North Shore. Where are people from that neighborhood going to go have their children? And where are the mental health services that Liz so eloquently explained that have gone away? Where are people going to get access to that? That is not just up to 1199 and the workers on the line tonight to explain. It's up to our elected officials, and it's up to us as community leaders. I don't know if there are any elected officials on the phone tonight or any community allies on the phone tonight. Or on the Zoom tonight. I'm showing my age phone. But really, it's up to them to answer us and answer that question and answer the community, and it's up to us to demand that. And so really appreciate that this call is shining another light on what's happening at North Shore Medical Center and Steward with private equity. But I'm really interested in what the next steps are and how we're going to take action to really inform the community, but then also to hold elected officials accountable to answering our questions about how care is going to be delivered. So just curious, Mark or Coy, do you guys have thoughts about that for the folks gathered tonight? Thanks.
Thanks, Roxy. We do have elected officials on tonight, and we also and representatives from elected offices as well as community. So if folks have questions in this space right now, it'd be great for folks to pose those. And just so folks know, we have to give context, and Roxy knows this, the team knows this, is that we have been doing outreach to our elected officials. The folks that are on the call are aware of the problem and have been reaching out to the folks at Steward. Again, I'll say we have Senator Chevron Jones on the call tonight. Welcome, sir. Appreciate you joining us. And we also have Sandy Sears, who is the representative from Congresswoman Wilson's office.
I mean, Coy, I do want to hear from them. Are they going to speak tonight or?
That'd be great.
Yeah, I would love to hear a reaction from the senator and from the Congresswoman's office of like, what can we do and what have they done to proactively, you know, help us shine a light on this and make sure that the community knows and affirm where is the community going to get their mental health care from and where they're going to get their women's health care from. I think it would be great to get a response to that and find out what else they think we should be doing or could be doing. That would be great. And then I think from 1199, Coy, I think it's really important for us to articulate what's the next step in the organizing. We have members on the line who I'm sure want to take action. That's what I heard in Blanche's question is what are we going to do? So I think we should, before we let 128 people leave this call, we should tell them what they're going to do. Thanks.
So this is Sandy Sears from Congresswoman Wilson's office, and we're very much aware of what has happened. It is really unfortunate. At a policy level, I think the priority is to have it better understood the role of private equity in healthcare. Oftentimes, the interest of the community is not private equity's top priority. So that's something that can be done at the congressional level. Certainly we have an interest in where patients will get their care. In that regard, before these layoffs occurred and before the services were actually closed, we did have conversation with the CEO at North Shore to make sure that there had been conversations about clear policies and procedures for patients who needed care no longer available at North Shore, so that one of the options would be for them to get their care within the Jackson Health System. I'm not saying that that's ideal. I'm not saying that it's necessarily preferable, but what I'm saying is that we wanted to make sure that there was a plan so that patients did not go without health care. And again, that's either at Jackson Memorial or Jackson North Medical Center. Of course, there are other options should patients choose to. So this evening, I'm basically listening. I will take the information back to Congresswoman Wilson, and whatever we can do, we certainly would want to do. The whole thing. Go ahead. I'm sorry.
Yeah, this is Roxy Nelson. I really appreciate that response. I think that's and I think Jackson is a great health system. We have a sister union local there. I wonder if the Congresswoman's office would be willing to partner with 1199 one day in the coming weeks to do some door knocking and canvassing in the neighborhood around North Shore Medical Center to inform the community about what the Congresswoman has to say about what's happening at North Shore and where they can get the services that they need. I think getting in the practice of like making sure that people that live there are aware. I think we as 1199 feel really a sense of urgency around doing that service for our community. And so would love it if to know if the Congresswoman would be willing to do that and partner with 1199 delegates to do some education locally in the North Miami neighborhood. Is that something, do you think the Congresswoman would be interested in co-sponsoring with us?
It's something that I will take back.
Okay.
Now, when this occurred and we had a conversation with the CEO, it was our understanding that there was a marketing plan which included communications to the surrounding community about not only the fact that North Shore would be closing services, but what alternatives to receiving care would be. I don't know if that was executed or not. I don't know, but it certainly was discussed.
That's helpful. That's something we talk to the CEO on a monthly basis. So that's something we can verify has or hasn't happened. And we'll get back to you guys on that for sure. Absolutely.
Okay. We're talking about Mr. Contreras, right?
We're actually talking about his boss, I assume, but we'll figure it out.
Oh, okay. All right. Very good. Thank you. Thank you.
Roxy, it is his boss that you're speaking on.
Yeah.
Contreras's boss, Daniel. Yeah.
Hi, Daniel.
We're gonna offer up that information too later in the call. Thanks for that.
Is Senator Jones still on? Okay, thank you, Coy. That was helpful.
Yeah, my bad. It looks like he's dropped. Yeah.
Thank you.
Hello.
Hi, here's someone talking.
Hi, this is Patricia. I'm from Senator Jones' office. He's on his phone, so I'm thinking he's having technical difficulties. Just so we are aware of the situation as we met with some of your members in March when they came to Tallahassee and they spoke of the conversation. We're still being briefed on it. We haven't had a chance to speak with the CEO as of yet, but the goal is to see what's going on and see how we in our office can help with the situation. I'm sure the senator will have more ideas on how this conversation should go and what routes we can take as a state on a state capacity.
Appreciate you, Patricia. We'll make sure we do some follow-up with you post this call early next week.
Appreciate that.
And I'm not sure if anyone from Mayor Cava's office was able to join or Representative Joseph's office. It's a lot of folks on the call, so I might have missed you. No? Okay. All right. I don't see any more hands for any other questions. I'll pause for a minute to see if anybody has any other questions for Mark, the members, or Pat or Sandy. Okay. Am I passing this back to you, Amy?
I believe you are. What great information and a lot of great questions that we got answered tonight. Mark, I want to thank you so much for all that information. You've really brought light to a lot of things that probably people didn't even know about. Wanda, you as well. Wanda, I did have a question for you though. When you do order your supplies, how long does it take to get it back? Is Wanda still on the call?
Yes, she's still there.
Wanda, can you hear me?
Okay, there I go. Listen, it's according to who we getting it from. Like if we get it from Medline, if I order it Monday, I can have it Tuesday.
Oh, okay.
But
Okay.
that's how that goes. But like from other companies, it may take about 3-4 days.
Okay. And does that affect the care of your patients? Them having to wait for so long? Or?
Yeah, having to wait because sometimes some of us be on back order. But like I said, like if they need something and we know we are on credit card with the company, I would
Yeah.
get the order and I would put it in and the buyer would cut the PO. Once we get the PO, it we'll send for the company to give me a performer invoice, and then we'll send it up to the CEO and tell them that we need this for a case. We got a patient that's coming in later on early tomorrow morning, and I would have it sometime that evening.
Oh, okay. Okay.
Mhm.
All right. Well, thank you, Wanda. I appreciate it. And
Thank you.
Mark and Liz, you guys are wonderful. Liz, your delegate sister, I'm so sorry what you're having to go through. I hope definitely we as a union can do our part and do what we can to help you guys and the community as well. With that being said, this is going to be a really big election year.
My bad, Amy.
Yep.
Real quick before you go into that, before you go into like the big election year and some key dates that are coming up, I want to give you a heads up that I will do the call to action at the end. I don't know if you're seeing my text. I just wanted to make sure you saw that.
Oh, I'm sorry, I'm not. I'm sorry. Okay. So can I go?
Yeah.
Okay,
Yes.
okay. So anyway, it's going to be a really big election year, as we all know, and I would say, let's really do our research before we head to the polls, because we need. I mean, obviously, we got some, partnership with some elected officials that are on here tonight, but we really need to research, and we need to elect people that are for our healthcare system, that are for workers, that are looking after the community. We need to get that information and let's make Florida better, because the only way we're going to do it is head to the polls and elect the right officials, guys. So another thing is we are going to vote yes on Amendment 4 and candidates who will truly serve the people, as we just said. Our union soon will start announcing the support and who we're going to endorse. So keep an eye out for all that information. We're not telling you who to vote for. We're just saying we're telling you who we're going to support. So research them, people. Mark your calendars as well. Our next We Care committee will be May 16th. Again, May 16th. And Coy, I'm going to pass it to you to do the call for action.
Beautiful. Thank you as always, Amy. Amazing job. Like, this is, I think, been the highest turnout we've had on one of our We Care committee calls. Let you know that this issue is important. The issue is real, and it's not going to get any better. You heard from Mark, you heard from Liz, you heard from Wanda, you heard our EVP call on our elected officials to ask them what can they do, what can we do together. And I want to ask two things. One, the community folks that are hearing the sound of my voice. Aaron or Des is going to drop a flyer in the chat. We are actively calling a target at Steward. And the ask is what you want to know as a community member, what is going on with North Shore. You need answers, and you need answers now. They're hearing from us. They're hearing from the elected officials. Now we need the community to add some extra layer of attention to this. And the idea is, of course, and I don't know if you guys dropped it, and the idea is, of course, is that if they continue to hear from members, if they continue to hear from elected officials, and they continue to hear from the community, it will force them to be more transparent. It will force them to do the right thing. It will force them to do the right thing, period. So Aaron or Des, if you could drop that in the chat, that's my first ask for everybody that's hearing the sound of my voice, all the community folks, members from 1199, staff, if you haven't already, we're asking you to make this call to this target. And we're asking you to make it today. And then the next ask that I have is for our elected officials who joined us tonight. We would like, because we know Mark had mentioned earlier in the call that this problem just isn't in Florida. It is a national problem. We are also dealing with this in Massachusetts on a large scale. You saw some of the articles come across your screen as we were talking about the problem. This isn't going to go away unless we continue to put some added pressure. So what I'm asking our elected officials to do is to stand alongside Senator Waring and Senator, I could always mess his name up, Mark Lee, who put out a public letter calling on Steward to do the right thing, calling on those facilities to do the right thing. We're going to ask those elected officials to do the same. We're going to ask them to stand up with our Massachusetts elected officials and our Massachusetts brothers and sisters and our Floridians here to make a public statement. So we let Steward know that this is not okay and they need to do something about it ASAP. I'm going to stop there and see if there's any questions. And I don't see the flyer in the chat. Des or Aaron, if you guys can drop it in the chat or drop the name and the phone number, would be super helpful. And I see 2 questions in the chat. Please break down percentage of private pay, Medicare, Medicaid services. I'm going to see if there, oh, I see Roxy answered them. Thank you, Roxy. Appreciate you. All right, before I let everybody go, I just want to make sure we get that flyer in the chat if possible, or at least the information. Jude, it looks like the comms team is trying to find Jude. Do you have it handy? If you could drop it in the chat for us.
Yeah, I don't have it handy. This is Des. I can stop sharing though. Maybe that would be easier to help me find it.
Yep.
I'm working on uploading it now.
Oh, thank you, Aaron.
Thanks.
But I know the stupid official is Daniel Nell. It's just a matter of getting the phone number, which I think is the North Shore Medical Center. Phone number.
Thank you both. Again, I appreciate you all taking the time out to get on this call. There's a flyer. Thank you much, Aaron. Again, we will have our next We Care committee call on May 16th at 6 p.m. Same Zoom link. And I hope to see you all there.
Thank you, Coy.
If you want to stay open so folks can download the
Yep,
flyer,
will do.
it's in the chat, like Coy said.
Thank you.
Thank you, Aaron.
All right, good night, fellas and ladies and gentlemen.
All right, thank you for joining.
Everybody.
Good night, everybody.
Thanks for
Good
the
night. Thanks for joining.
making my call right now.
Thank you, Roxy Nelson.
Good night, everybody.
Good night. Thank you again for joining.
Welcome.
I'm home. Weird today. All right, good people. I appreciate you for all leaning in. If you didn't get a chance to get that name and number, it's still there. I'm going to bid you all a good night. Thanks again for joining our We Care committee call. Love you all like cook food. Bless and good night.